We're here in downtown Pittsburgh outside of Senator Bob Casey's district office, and we just wanted to thank him for his support, but also really ask him to take a leadership role on this issue and to stand strong since we know that he's going to be having a lot of people lobbying him and trying to get him to back off of the public option.
Healthcare is a human right. It's not a commodity to be bought and sold like automobiles or chewing gum.
Competition is part and parcel of the free enterprise system. When it comes to health insurance, though, I don't see companies competing for our business in the usual way. In most, if not all markets, there are usually a couple of insurance giants who call the shots with us, the insured, at their mercy. Co-pays, deductibles, pre-existing conditions, caps on care, excluded procedures, the threat of being dropped, the list goes on.
I'm one of the underinsured. I have a $1,250 deductible every year on top of my premiums before I can get any care. I also work with the unemployed, and I have people in my office all day long who have lost their health care because they've lost their jobs. People that cannot get insurance, that are being denied claims, people that are facing bankruptcy because of medical bills.
And in our country, 70% of all the bankruptcies are precipitated by unpayable health care bills. So the whole system is just totally corrupt and
you look at the statistics,
dysfunctional.
we pay more than any other industrialized country, and our health care is not as good.
I've got my entire career as a physician ahead of me, and I really can't stand the thought of inheriting the system that we have, battling with a horde of profit-driven insurance companies every day for the rest of my life, just to provide the care that my patients need, is not what I want to do. We need a game changer, a national public option that's open to everybody, and we need it now.
My husband was essentially killed by an HMO back in the 80s because they were too cheap to do a CAT scan and discover his brain tumor. So yeah, I've been interested in this for about 25 years now.
A single-payer national health program is really the ideal. It's what we'd want to see if we could have what we wanted. In the absence of that, the very, very minimum that we need is a national public option that's open to everybody. What that would do is it would allow people to keep the current health insurance they have if they're satisfied with that, and if they're not, or if they don't have health insurance, it would allow them to buy into an affordable option that would be comprehensive.
We need the public insurance option to provide real competition for the private sector and drive down costs, and also to just help the uninsured obtain coverage and get access to medical care today. It's just so important. We can't wait any longer for healthcare reform.